13 past 2. We'll have more of your calls on First Aid and feedback, 131873 shortly. But when it comes to health concerns, prostate cancer is a major issue here in Australia. 1 in 6 men are diagnosed with prostate cancer by the age of 85. 1 in 6. And it's the most commonly diagnosed cancer among Aussie men. Thankfully, though, huge developments in science and technology and prevention and treatment means that it's getting much better to ensure that the outcome is not the dire outcome it has been in previous generations, not for everyone at least. And in today's Tuesday Checkup, we're talking prostate cancer, other health issues too, with urologist Dr. James Symons from the Sydney Adventist Hospital, the SAN Hospital. They're harnessing the latest advancements in health, all while giving you the attention, respect and care that you deserve. So if you've got a question for him about prostate cancer or anything else about urology, including male incontinence, call in now, 131873. Dr. Symons, welcome back to Afternoons.
Hi, Deb. Thanks for your time. Great to be here.
Well, it's good to have you back because I know that you're on with Joe and we had a lot of people very interested in this topic. And it is true the way that we detect, prevent and treat prostate cancer. It has come a long way, hasn't it?
Oh, no, absolutely. The basics are still the same, if you will, with a blood test and an examination, but there's a lot of advancements happening in the imaging front, and the hospital that we understand is definitely leading the way in that space.
And you've got the new Prostate Centre for Excellence at the SAN, and I think one of the barriers that a lot of patients face, whether you're being treated for prostate cancer or anything, for knee surgery, whatever it is, you constantly have to jump around between various professionals and doctors, and you've got it all in the one place here.
Yeah, look, any sort of health issue obviously is going to be stressful for individuals, and we're trying to very much try and smooth the process through to try and make what could otherwise be a very challenging experience, something that, whilst not necessarily enjoyable, is going to try and minimise the stress involved coming through. Yeah. There's great in-house radiology with really world-leading experts, and we all work as a collaborative team in order to get the best results for the patient.
And what are the early signs, the typical early signs of prostate cancer? What should men and their partners be on the lookout for?
This is one of the really challenging things, in that actually early, like truly early prostate cancer, when it's still sitting within the prostate and not spread anywhere, often doesn't have any signs at all. So a lot of the inklings that something's going on, you might feel the urine sort of starting to slow down, or seeing a little bit of blood coming out with some of the liquids that might come through. They're all generally going to be sort of late signs of prostate cancer. That's not really when we're going to catch them. So the best way to get an early diagnosis when things at a very detectable level is through routine checkups and screening with your GP.
And what is that test? What does it involve?
That is traditionally been the PSA test, which is a blood test. That's a simple needle in the arm. And best practice guidelines would suggest that people should be getting that from the age of 50.
So 50 on. 50 is the age when so much needs to happen, isn't it?
It's a turning point in life.
Yes.
And look, I've passed 40, and the turning points also happen there as well. So people with a family history of prostate cancer should be having a chat with their GP, sort of a well-manned checkup, amongst other things. At the age of 40, get your blood pressure, cholesterol and other things checked. And if you've got a strong family history of prostate cancer, they're really the blokes that we want to catch as well.
Yeah, absolutely. 131873 is the number to call. Rodney has a question for Dr. Symons. Hi, Rodney.
G'day, Debbie and Doctor. How are you?
Very well, thank you.
Yes, I was diagnosed with stage 4 prostate cancer in 2019. They said it travelled to the lymph node. It went a little bit in the back and a bit in the bladder. Now, I've also had radiotherapy in 2020, and I have a checkup every 12 months. I said there's none in the bladder and there's none in the backbone. Now, when I first diagnosed, my cancer marker was 34, and now it's
quite high.
And now it's 009.
Well, that's great.
Now, is there anything new on the market? Now, I've heard from doctors that you should keep away from sugar because cancer loves sugar. Is that true or not true?
Oh, look, you just want to have a normal diet. So look, people love to think that there's this idea of the locus of control where not just yourself but the general population would like to try and do everything that they can to get the best sort of life and health outcome, control the things that you can control. The idea that sugar per se is bad for cancers doesn't really bear fruit. But sugar does lead to excess body weight, and excess body weight certainly is associated with lots of different types of cancers, coming on and getting worse outcomes, prostate cancer amongst them. So sugar is not really the bad thing per se, but being overweight, carrying excess weight around, and the insulin resistance, which can be sort of affiliated with sugar, that can definitely be bad prognosis.
But that is a good result that Rodney's seeing with the marker levels.
His numbers are great. His numbers are really good.
Yeah. All right. Anil has also called in with a question. Hi, Anil.
Hi, Deb. How are you?
Yeah, good. Thank you. What's happening with you?
I'm 35 years old, and when I did just a regular blood test 2 years ago, they shipped high PSA on my blood test, and I was referred to the specialist urologist, and I did my MRI blood test a couple of times, and they didn't find any swelling, anything, but my PSA is still high, and so I'm just. The specialist said that no need to worry, but still it's high, so I'm worried. So
yeah, no, that's a good question.
How old are you, Anil? Sorry, I missed that at the start.
I'm 35 now.
35. Look, the probability of prostate cancer amongst a man in their 30s is very low, and if it's been going on for a little while, so it's highly unlikely that prostate cancer is going to be the cause for it. Some men will just run very high PSA levels, which obviously causes lots of anxiety for them. Similarly causes anxiety for me because I don't want to miss anything. And if we want to, if something there's going to catch it early. Sometimes it's just going to be chronic inflammation. Maybe there's been a bit of a grumbling infection, and that the level of PSA in your body gets reset, and it's just forevermore going to be at a higher baseline.
And Rick is asking as well, is a PSA of 2.8 okay? What is considered high?
Oh, that's a really good question, Deb, actually. There is no normal PSA. And so it depends upon the age, but really if you have any age, the PSA, half the men will be walking around with a PSA below 1.6. So if a man's the age of 40 or so, the PSAs will be about 0.8. 50, they're about 0.9. And even when they get up to in their 80s, half the men should have their PSAs below 1.6. So his levels in the 2 are going to be on the top half of the age, above the median. And if he's a young guy, then that PSA 2.6 actually could be an issue.
Yeah, so something that you've got to follow up on your specific circumstance. Yep. We might take a quick break. Some more calls coming through. 131873. We're talking Tuesday Health with our urologist, Dr. James Symons, here on Afternoons with Deborah Knight. It is our regular Tuesday health checkup with Dr. James Symons, a urologist at the Sydney Adventist Hospital. A lot of calls and questions coming through. Let's get straight to them. Emily, what was your question for the doctor today?
Dr. Symons, a 53-year-old male with hematuria with unknown cause, cystoscopy, normal PSA, normal renal, normal bladder, normal, no lesions, except for a mildly enlarged prostate.
Okay, so this is a person who's had all the workup done by a urologist already.
Yep.
Look, that's to start the basics with blood in the urine, just for the other listeners.
So hematuria is blood in the urine.
So hematuria is blood in the urine. So hematuria is if you can basically see, or your GP on a dipstick detects a little bit of blood there, is never normal and needs to have a bit of an explanation as to what's going on, because there's a significant cancer risk attached to it, possibly not in this instance. So if you've got visible blood in the urine, about 1 in 5 to 1 in 10 patients will have a bladder cancer or tumour somewhere within the urinary tract. So it needs to be checked out, much like if you have a bit of blood from the back passage. In the sort of workup that we do, we get scans, we get urine tests, and then we end up often having a little look inside, doing a telescope examination called a cystoscopy to have a look inside the bladder. And that's a routine day surgery procedure, much like I'm doing today, actually. Those sorts of procedures are done around the country and readily accessible. So you need to have a chat with your doctor to get referred through to a urologist if you're seeing some blood in the urine. For a man in the 50s, if there's a normal scope and normal scans and the prostate's enlarged, it's probably, not definitely, but probably going to be coming from the level of the prostate, much like young kids can often get a blood vessel on the nose that needs to be cauterised because they get a bit of a bleeding nose around winter time, a bit of sneezing. The same can happen from men as well. Often they might be a little bit constipated, doing a bit of straining, and essentially like pop a rivet and start to have a little bit of blood that oozes out.
So it may not necessarily be a sign of a cancer.
No, definitely not. Definitely not. But because bladder cancer can be just such an unhappy sort of disease, it needs to be investigated just to exclude it.
Yeah.
But, most people, the odds are actually in your favour. So most people will all check out accordingly. And so sometimes it's just going to be a simple thing like a urinary tract infection or a kidney stone, something very treatable.
All right, Emily, all the luck, all the best with that. Alan's also got a query. Hi, Alan.
Yes, hello.
Hi, what did you
Hi,
want to know
Alan.
from the doctor today?
Hello, Doctor. Look, I've been diagnosed with prostate cancer. I had a high reading. I thought it was 21. It might have been 2. I'm not sure, but 21 they told me. And they did the biopsy, which proved there was a little spot in there. Then they did the PET scan and all the other MRIs and everything. At the moment, they said they weren't going to operate. They've got me on hormones. Is that the way to travel, or should I go to a specialist?
Look, you probably had a specialist involved.
I'm getting treated in the local hospital.
Okay. Look, you've probably had a specialist involved if you've had the biopsy done. I don't have your specifics. What you'd be wanting to do is see a specialist urologist who's involved in multidisciplinary team meetings, much like we do here at the SAN and other big hospitals, which will be where you've got a team of specialists interested in prostate cancer, who are specialists in that domain, really have a chat and yarn about every patient to sort out the best pathway forward. But so, look, the cancer treatment with some hormones is one possible way to go treating things. Often you don't need to do it unless it's spread. So I'll be wanting to know what your scans are to really give you accurate advice.
But definitely get a specialist involved. Lindsay's just asking
definitely.
too on the text, is there an upper age limit for doing PSA tests, or do you just keep on going?
Look, that's a really good question. Generally, consideration had been to go up to about 70 to 75, but people are living longer and longer.
Yes.
And 80 is the new 70, and 90 is the new 80. So there are a lot of people who are, not ready to hang up their spurs at, age 75, 78. And so if they've got a good life expectancy, another 10 to 15 years ahead of them, then there's somebody who we would still consider doing a PSA test on.
All right. Unfortunately, we are out of time. We'll have to revisit this topic again in the future. Dr. Symons,
Lots to
thanks so
talk
much.
about.
Yes, and a lot of interest in this topic, understandably. Thanks so much for joining us.
Pleasure. Happy.
Dr. James Symons, a urologist at the Sydney Adventist Hospital, and you can visit their website to find out more, sah.org.au. It's 2.